Thanks again for joining us today for this SAMHSA-sponsored webinar on the Evidence-Based Resource Guide series. Again, we're looking at community-level policies to prevent alcohol misuse. My name is Van Wilson, and I'm with the Prevention Technology Transfer Center Network Coordinating Office. We're just supporting the facilitation of the webinar today, the technical side of things. So I'll be sharing slides, running our Zoom host here, and a couple housekeeping things just to get us off on the right foot. So obviously we've made every attempt to make our presentation secure. However, if we need to wrap up unexpectedly, we'll certainly follow up with information. If you have a question for the speakers, I'm going to put an email address in the chat here now or on today's content. You can email the address I just put there in the chat. I'll encourage you at the end of today's webinar, I'll send out a brief survey. I'll put that in the chat here as well. And really encourage you to fill that out for us, helps us do better. And then following our session, I'll send out an email with instructions on how to access your certificate if you've attended at least 30 minutes, links to the recording and the slides for today, and also our certificate. I think I already said that. Today's event is closed captioned. If you've used that feature in Zoom before, it's at the bottom in your control panel, and look for the closed caption, and then you choose show subtitles. Last but not least, give us a follow on social media. So we're the PTTC network. We're a SAMHSA-funded prevention workforce support training and technical assistance center. Again, the PTTC network. And as I just noted before, we are recording our sessions and we'll be posting these on our website in a week. If you have never heard of the PTTCs before, or SAMHSA's Prevention Technology Transfer Center Network, I'll take 30 seconds and give you a quick elevator spiel. As I mentioned, we are a SAMHSA training and TA provider to support the prevention workforce, helping all aspects of that with training, strategy, and leadership. And we have regional centers in each one of the 10 HHS regions, and then also 2 nationally focused centers, population focused centers, one for our National American Indian and Alaska Native partners, and our National Hispanic and Latino. And I am with the network coordinating office based out of the University of Missouri, Kansas City. And we like to begin all of our events here with just a moment to affirm that language matters. Language has the ability to inspire hope. Our words have power, and we're always learning more about how to put people first. And we affirm that here amongst our PTTC network and our partners, our SAMHSA partners. So that concludes it for me. You'll hear from me a little bit at the end with some additional instructions in our survey, but I'm going to go ahead and hand this off to Rob Vincent, Associate Administrator for Alcohol Prevention and Treatment Policy with SAMHSA. Thanks, Rob.
Thanks, Van. And let me just say welcome to everybody joining us today. There is a lot of interest. As Van said, my name is Rob Vincent. I'm the Associate Administrator for Alcohol Prevention and Treatment Policy here at SAMHSA's Substance Abuse and Mental Health Services Administration. I'm pleased to kick off this webinar today. It's about an important topic that's near and dear to my heart, and it's a new guide from our Evidence-Based Resource Center. And the guide is titled Implementing Community-Level Policies to Prevent Alcohol Misuse. During the next hour, we're going to learn about the process used to develop the guide and the research included. We're also going to hear from our guide subject matter experts and some of our technical experts panels, as well as some representatives from 3 of the communities featured in the case studies with the guide, and the strategies used to implement them in each of those communities. The guide was developed under the leadership of SAMHSA's National Mental Health and Substance Use Policy Laboratory, in collaboration with the Centers for Substance Abuse Prevention and Substance Use Treatment. The guide is one of a series of guides that covers several diverse topics. To date, SAMHSA has released multiple guides on a range of topics related to substance use and mental health. The guides shown on this slide today are available in the SAMHSA store, so please feel free to go and download those or take a look at those. This year, we've worked on 5 different guides that will be released this fall, including this one. It's important to note that SAMHSA's vision for and the underlying foundation for these guides really is to reflect the scientific rigor and to make recommendations from evidence base. We provide expert consensus. It's designed to be comprehensive and modular for practitioners, administrators, and other stakeholders so that they'll be able to use the guide in its entirety or just use sections relevant to their needs. More importantly, we want it to be accessible to the field. We're pleased to announce that this guide, Implementing Community Level Policies to Prevent Alcohol Misuse, was posted in the SAMHSA store on November 2nd. So please feel free to go and download it there. And to speak more about the guide, I'd like to introduce Dr. Alicia Sparks, who is the lead for this guide and one of our subject matter experts. With that, let me introduce Alicia.
Thanks so much, Rob. And I just want to, again, reiterate my thanks to all of you for being here. You know, prevention can feel kind of like a lonely field sometimes. You feel like you're the only one out there doing that, especially prevention of alcohol. And then you add, you know, community level policy on top of that. And you really sometimes feel like you are alone in a storm. So I just want to take a minute to acknowledge that over 1,700 people registered for this today, and there are almost 700 of you on today. So those moments when you're feeling frustrated or isolated or like you're by yourself, just know that, you know, you've got a team of 700 other folks out there who are also doing this work. So we just want to get started with some basics before we dive into the guide a little bit more. You can see here how we are defining alcohol misuse for the purpose of this guide. And I'm not going to read it to you, but you can see the key points here is that when we think about alcohol misuse, that is binge drinking, which is, you know, 5 or more drinks for men and 4 or more drinks for women on a single occasion, or heavy drinking, which is more 8 drinks or more for women, or 15 or more for men in a single week. Any underage drinking, driving under the influence, or drinking by a pregnant person. So that is how we are understanding alcohol misuse for the purpose of this guide. But I do just want to be really clear that even within these definitions, there is no universally agreed upon safe level of alcohol use. The U.S. dietary guidelines for Americans do recommend that men limit their intake to 2 drinks in a day and women to 1. But again, there is no safe level of alcohol use. So just putting that out there as we think about how we're talking about alcohol here. I also just want to note that when we talk about the prevention of misuse, we are really talking about this broader group of people who consume alcohol to help protect those folks and those around them, as well as the communities that experience alcohol-related harm. And so the prevention efforts we're talking about are focused on the broader folks of people, as opposed to those who are just needing treatment for alcohol use disorder, which is a medical condition. So again, we're thinking big picture here. How do we address the quite a few people, which we'll talk about in a minute, who engage in alcohol misuse versus those who are at risk of alcohol use disorder? Next slide, please. So just to give us a quick, brief understanding of the scope of what we're talking about here, this is just past month binge drinking. And you can see that nearly 1 in 3 people between the ages of 18 and 25 report binge drinking in the past month. Nearly 1 in 4 over the age of 26, and even 4% of those who are between the ages of 12 and 17. So when we put that into real numbers, that's over 70% of people over the age of 21 who report drinking alcohol in the past year. That's 166 million people. And then if we're looking specifically again at binge, you can see these high rates. And we're also seeing rates of alcohol misuse increasing in older adults as well. There are differences, next slide please, by different populations. So we know that men drink more, for example, than women, but those rates are changing and women are starting to drink at faster rates than men are increasing their alcohol consumption. So we're seeing a leveling there. We also know that biologically and physiologically, alcohol affects men and women differently. And so it's important to take those into consideration when we're talking about how much people drink. Also, those who identify as a gender other than the sex they were born with tend to have higher rates of alcohol misuse and higher rates of harm. You can also see some stats around race and ethnicity here, but what's important to note is that although people who identify as white tend to drink the most, people who live in predominantly communities of color actually are disproportionately exposed to alcohol, largely through the presence of alcohol outlets in that community. So for example, in Baltimore, if you are in a low-income, predominantly Black community, there are 8 times as many alcohol outlets as if you're in a different community. Again, 8 times as many alcohol outlets. And again, with socioeconomic status, although people who have the highest income tend to binge drink the most, it's people who have the lowest incomes who tend to have the most harms. Next slide, please. There are a number of harms associated with alcohol use, both at the individual and at the community level. The latest data do show that alcohol causes over 140 deaths each year. And you can see a host of other conditions here and harms that are related to alcohol misuse. And what's not listed here, but it's important to note, is alcohol is associated with 7 different types of cancer as well. So there are chronic conditions, there are acute situations, there's injury, crime, violence, and much more. So now that we have, next slide please, laid the groundwork for what we're talking about with alcohol, we want to dive a little bit more into this guide. So this guide specifically focuses again on community level, evidence-based policy options to prevent alcohol misuse for both youth and adults. And throughout this, we talk about implementation and evaluation strategies, and we are really embedding equity throughout each component of this. And I'll try to talk a little bit about how we do that as we go through here. But I just want to acknowledge again that prevention efforts that focus on all people in the population have shown to have the greatest impact on substance misuse and related harms, as opposed to those interventions that focus on individual level changes in alcohol misuse. So we are really focused on those alcohol misuse prevention efforts, such as raising taxes, reducing density, that can help promote and maintain healthier and more resilient communities at that broader population upstream level. Next slide, please. So the guide has 5 chapters. The first chapter goes over the alcohol problem. When we talk about alcohol, what are we talking about? It gives us some data around alcohol misuse, some current approaches and challenges preventing alcohol misuse among youth and adults. Chapter 2 dives into the actual data on the effectiveness of prevention policies. And so that's what we'll spend a very brief amount of time talking about today. Chapter 3, which is identifying and implementing evidence-based policies, is really about practical information to consider when you are selecting and implementing which policy to put into place in your community, state, tribe, wherever you are located and what jurisdiction you're operating in. And we'll spend most of our time today talking about implementation. Chapter 4 gives us 3 case studies from different communities who have implemented these policies, and you will hear from folks today about how they did that. And then chapter 5 is about evaluation. So again, how you evaluate prevention and policy and make sure that you are maintaining that work. So to develop this guide, we worked with our colleagues at SAMHSA and our subject matter expert, Dr. David Jernigan from Boston University, who you will hear from in just a moment. And we worked with them to identify the goals of this guide, who the audience is, which is all of you, and our population of focus, so youth and adults. We also had the really great opportunity to work with researchers, practitioners, and advocates who have expertise in alcohol prevention and implementing these policies to help make sure that the guide that we put out is evidence-based, grounded in science, but also really useful to the folks doing the work on the ground. We've conducted systematic literature reviews of all of the policies and identified these case studies, and then collated a large number of tools and resources to help support implementation and evaluation. So I'll keep referring to that as we go through, but please do download the guide and you will see tons of links that will help you as you navigate this process. So now I'd like to introduce my mentor, Dr. David Jernigan, who is a professor in the Department of Health, Law, Policy and Management, and the Assistant Dean of Practice at the Boston University School of Public Health. I can say many more things about him, but hopefully many of you know who he is. So I will hand it over to him to talk a little bit about the role of technical experts in this guide. David.
Thanks very much, Alicia. It was my pleasure to serve as the lead subject matter expert and to work with a distinguished panel of experts, next slide, from a wide range of fields. And we can go to the next slide. Our job was to really look over the shoulders of Alicia and her team to assist them to conduct a systematic literature review and to just all the way along. I don't think this is the right slide. Can you go to the next slide? No? Okay, go back. Okay, to we reviewed the slide, we reviewed the work product over and over again, looked at it in outline form, then looked at it again, suggested further resources, provided input into the case studies, and so on. Just in every way tried to add an expert eye to this to make sure that what the guide reported on and recommended to people was as firmly grounded in the science as was possible. Next slide. So the guide used these criteria for the systematic literature review and then organized policies into 3 categories: those with strongest evidence, those with moderate evidence, and those with limited to no evidence. And we really were quite scrupulous about exercising judgment and trying to go with what was most strongly supported by the evidence. And now I'll turn it back to Alicia.
Thanks, David. And I just want to note that with these 3 categories here, strongest evidence, moderate, and those with limited to no evidence, the reason that we included those with limited to no evidence is that oftentimes in prevention, as you know, the field is a little bit ahead of the science. And so we really relied on these broader understandings that you can see here of availability when we thought about which policy that we're going to include and how we're going to talk about those. So I do just want to note, as you're going through the guide and you see the different policies that we've talked about, there are those who have this strong level of evidence behind them, and you can see those on this slide here. But we've also included some that we really recommend folks consider for future research as well and for future implementation. And you're going to hear about some of those in our case studies today as well. But it's, again, we're really relying on this framework of availability. And so if you are reducing availability to access to alcohol, then we expect that you're going to see changes in consumption and harms down the road as well. So we grouped ours into this framework of 4 different categories of availability. Physical availability is how, where, and when, and to whom alcohol can be sold and where it can be consumed. And you can see here that we're talking about regulating alcohol outlet density, the minimum legal purchase age of 21, and limiting days and hours of sale. Financial availability is, as you expect, the price of alcohol. So things like raising taxes, minimum pricing, which you'll hear about shortly, bans on price discounting, such as happy hours and things of that nature. Social availability, which can include things like getting alcohol from non-retail sources, so from peers, from families, that is what in that way, as well as thinking about the normative climate around alcohol. And that ties a little bit into psychological availability, which is exposure to marketing or other factors that influence how accessible alcohol is to them and their lifestyle. And so we are talking about limiting alcohol advertising and marketing in that way as well. Next slide, please. So these are the primary policies that we're talking about as evidence-based, and we're not actually going to go into the weeds on what these policies are and what they mean and, you know, the evidence behind them, because there are so many great tools out there in addition to ours that help define those for you. So you can see on this slide links to, and you will get these slides and the links are in the guide as well, a number of key resources that talk about each of these different policies. So what our guide did, in addition to our systematic review, is take all of these policies and try to make a really concise summary of each policy, talk about a few examples of where they've been implemented before, and then also provide the equity considerations for these policies in terms of implementation, enforcement, writing, all of that, so that as you're reading through it, you're really considering whether these policies will have a disproportionate impact on different communities, both positive and negative. So we encourage you to go read more about these policies in the guide so that you can brush up on them, and then feel free to go back to these resources as well to learn more. Next slide, please. So we're going to focus today on implementation, and this is just an overview of considerations for implementation, and also just thinking about how to choose the policy for your specific community. So the first step here is often conducting capacity and a needs assessment. And I just want to flag here that often we hear, okay, you need to conduct a needs assessment to understand where the gaps are in your community in terms of what the problem is and where the gaps are in addressing it. And that's true, and that's really important. But I also really want to recommend you all come at this from a strength-based perspective and think about, where are your existing capacity? Where does that exist? Where are your resources? What do you already have in hand that you can draw on and learn from and partner with in order to start addressing this? So, there's this needs and capacity assessment that could happen at the beginning to help understand the issues here. And then again, we're summarizing key elements for successful implementation here. And that includes building your coalition, making the public aware of the issue at hand and the solution to help mobilize them, what the regulations or policies are that you should be passing or consider passing, enforcement of those, and then the economic impacts, which of course will come up time and again as you're talking about these. We also provide a framework around equitable implementation. We just give you the quick bullet points here, and we encourage you to dig in a little bit deeper to that in the guide itself. So I'm going to go through a few examples of implementation considerations for you. Next slide, please. That we have seen from the literature and from our time in the field as well. So the first is building coalitions with capacity. So we often hear folks say, we think this work is really important, but we don't have the bandwidth to do it. And so in thinking about that, we hear in terms of funding, we don't have the funding, we don't have the staff, and we don't have the expertise or the training to do so. We know this is an issue, but I think that there are some really great options out there to help overcome this. And so the first is broadening and diversifying your stakeholder base. And so as you're thinking about who can help, I think it's sometimes helpful to think beyond the traditional players in this. So make sure that you're reaching out to tribal communities who might be affected by the alcohol environment. Reach out to your health sector, your safety sector, your education sector. In addition to making sure that you have, multi-sectoral representation on your coalitions, make sure that you have folks from the community as well as community leaders. So you want to have that mix of people on the ground and then people who are able to make change. I also really want to encourage that your coalition is representative of the community that you're working with. So make sure that you have equal representation and equal power and voice in those discussions, regardless of the title or position of that person. Funding is so critical and something we all struggle with in this work. There are a number of state and federal grant programs out there, such as the Drug-Free Communities Grant, the Partnership for Success, Sober Truth on Preventing Underage Drinking. You often heard that as the STOP Act grant, and so many more. I also encourage you to think about the intersection of alcohol and other drugs and other issues that might have additional state funding that you can then tap into or rely on to help fund this work. And then finally, technical assistance. There are some really great technical assistance options out there in addition to private technical assistance. The PTTC network, like the one that we heard about earlier today, as well as the Center for Advancing Alcohol Science to Practice, funded by the CDC, are two examples of different resources that you can go to for free or low cost technical assistance to do this work. Next slide, please. So evolving community needs. So in addition to the fact that, we all are contending with opioids and the deregulation of cannabis and all of these other issues in the field, the way that alcohol is consumed changes on a regular basis, and it makes it hard sometimes to keep up with what we should be doing about it and what the appropriate policy solution is. So we really recommend that you regularly collect and analyze data to make sure that you are understanding what the patterns are. So you want to know who is drinking, you want to know where they're drinking, you want to know what they're drinking. I don't know if any of you were on the recent interactive dialogue from the U.S. Alcohol Policy Alliance and saw the proliferation of new products that are out there. It's hard to stay on top of that, but it's really important to know, are there these new high-risk products emerging in your community? And so some of this data collection is the surveys that happen at the state level or in your community, at schools, but also talking to folks in the field. So make sure that you are speaking with your parents, your educators, your retailers, your emergency room physicians, and just understanding what patterns are emerging. And these data will help support existing policy efforts or suggest the need for changes. And I apologize for going a little quick here. We've got a lot to cover, so I'm trying to fly through it all. State preemption. So as you know, state governments are often responsible for regulating alcohol. And this regulation can be preemptive. So it might limit the ability of local communities, counties, cities to pass policies that are more restrictive than the state policies. We run into this a lot where communities say, we can't change the density here because the state preempts it. But the good news is there's usually ways that you can still accomplish the goal you're trying to accomplish without running into preemption issues. So the first is really understanding what the state alcohol laws are, and then exploring available options. And so there might be non-alcohol specific local powers that you can tap into, such as looking at land use laws to help reduce alcohol outlet density. If you're not able to cap the number of retailers, for example, but you want to reduce density in your community, you could look at zoning so that you can't put new retailers within a certain distance of other retailers or within schools or daycares. So your ultimate goal of reducing access through reducing alcohol outlet density might be feasible without capping because of preemption issues. There are a number of legal experts out there who can help you understand this, who really specialize in preemption. So we encourage you to look into that. You can reach out to any of those TA opportunities before, and they can connect you with the right people. Long-term commitments. Those of you who have been doing this work for a while know that it can take years to get from knowing that there is an issue in your community to passing a policy to do something about it. It can be hard to, determine what the right policy is, educate your community and local leaders about it, and implement it and enforce it, and then to see the results of it. And so while this process can be long and sometimes frustrating, and you have to introduce bills multiple times or, wait out different cycles, it's really important that you maintain the work. So look for sustainable funding options at the beginning so that you're not doing one-year cycles of grants and always trying to play catch up on that. And then just make sure that you're preparing your coalition members, your partners, your lawmakers, your funders to be in this for the long haul, so that they're aware that it's going to take some time, it's going to take multiple efforts, but there is a high probability of success with that patience and perseverance. And make sure you're celebrating little wins along the way. This could mean that you got a piece in the local paper about the issue. You got a meeting with the lawmaker to educate them about alcohol. Maybe your policy was introduced but not passed this year. So make sure you're celebrating those local wins, keeping folks engaged along the way. And one of the things that we hear over and over again is that your coalition can't lobby because you receive federal funds. This might dissuade people from doing this work on evidence-based policies, these biggest bang for your buck policies, because of this concern. However, while there are lobbying limitations that should be considered and fully explored, there are a number of situations in which members of a coalition or an organization can legally lobby for policy change, either using non-federal funds or by thinking really carefully about what they are allowed to do, such as conducting research on a potential legislation, or talking to and educating elected officials broadly about misuse without getting into the weeds on specific legislation. We provide a number of resources in the guide to help you dig in a little bit deeper to this issue of lobbying. So I just want to say here, you can still do policy work. If you are a federally funded coalition, you can still do policy work. You just have to be really cognizant of what your options are and how you can go about doing this. But don't let this fear of lobbying deter you from taking on these really important evidence-based policies. Policy enforcement. So our policies are only as strong as they are enforced. And so if you pass a policy and then no one ever enforces it, no one will know it exists, and it will not actually lead to the change that you're hoping to lead. So we really encourage that the inclusion of explicit enforcement structures and funding for that enforcement be included in any legislation or rulemaking that's passed. And enforcement might be done by health departments. It might be done by your alcohol beverage control. It could be done by your law enforcement. There's a whole group of different folks who can do that. And we provide some details about that in the guide. But that language that's in that legislation could also include things to ensure that enforcement does not disproportionately target individuals or retailers of color, of the LGBTQIA populations, that they are conducting these enforcement efforts on a regular cadence based on the best available science, and that they are transparently reporting the results of these efforts to make sure that the enforcement is as evidence-based as possible and equitable and conscious of different communities as possible as well. And finally, the alcohol industry, we know, exerts a large influence on this work. In 2020 alone, the industry spent almost $30 million on lobbying at the federal level. That's $30 million. And they also fund research and provide funding for interventions with minimal to no public health impact. And so we are up against this issue of industry involvement in these communities. They're also often present in these different decision-making bodies, such as local alcohol beverage control boards, chambers of commerce, other instances where you might be going as a coalition member to try to make a change and engage in these conversations. So local jurisdictions have opportunities to limit the influence of the alcohol industry. State and community leaders, parents, and other stakeholders should be aware of attempts for the industry to get involved in these community efforts and prepare counter messaging that can help gain support for this overall public health message. So know what your industry opponents are going to say and then have the public health response to that. You can also encourage the equal, if not greater, presence of public health voices in these settings as compared to industry. We also encourage that any comprehensive policy should include media campaigns that promote messages to counter industry influences and also reach the youth who are most susceptible to this influence by the industry through marketing, branding, and other tactics. So I just flew through that. My apologies. There's a ton of more information in the guide along with resources for all of these different issues and all of these items that we're bringing up here. So dig in a little bit deeper to that, because now we are going to move into a couple of examples of how policies have been passed in different communities. We're going to hear about retail access from a community in Miami. In Florida, minimum pricing at the state level through rulemaking from Oregon, and then limiting hours of sale at the local level, at a district level, at legislative district level in Baltimore. So we're going to start with Miami Gardens, Florida, and we have a pinch hitter today. Next slide, please. Because Chuck Ridley, who is the executive director and the lead for this work, is dealing with the effects of Hurricane Nicole, unfortunately. So he is not able to join us, but the lead technical assistant consultant on this project, Michael Sparks, is here, and he's going to talk to us a little bit about how a coalition-driven initiative was leveraged to implement and enforce policies to reduce consumption in Miami Gardens. So Michael, I'll turn it over to you.
Good morning, and thank you. So I want to echo one of the points that Alicia made in the earlier comments about the time it takes to do this work. Policy does require an intention to be in the work for the long haul. My role in this, as was mentioned, is I was asked by Chuck Ridley in 2017, actually, to participate and become a technical assistance person working with Miami Gardens. I had known Chuck from a CADCA training in 2014 when he came for a CADCA Academy over 3 weeks. And during the course of that time, I'd actually known Chuck from 2005 when we did some work with Head Start in another part of Florida where he was living at that time. But when he walked into the training at CADCA, and over the course of the year that I got to know him more, he began to really shift the focus of his Drug-Free Communities Coalition from working on individual strategies to thinking about the retail environment. He intuitively knew, and we saw this over the course of the year together, that there was something amiss in Miami Gardens, Florida, related to their retail settings. And the exploration of that sort of evolved as we were working together and talking together. And at the end of that year of training with CADCA, he said, you know, at some point, we're going to have to do something about the retail environment. I'm going to have to shift this coalition I've been working with from thinking about individual strategies to really thinking about what we're going to do with these off-premise establishments. And sure enough, in 2017, he called me up and said, you know, I've done the work with the coalition. We are ready to begin to think about retail settings. And this whole work was part of a larger group of 60 nonprofits in the areas, nonprofits and governmental agencies called Live Healthy Miami Gardens, which had multiple areas, healthy eating, physical activity, but one of their core areas was looking at alcohol. And so that began the work of trying to understand from his perspective and from the subgroup of 15 to 18 people who were working on the alcohol policy work, what was really going on in Miami Gardens. So what we decided to do early on was begin collecting a lot of data. And so we made a decision early on to let the data drive the selection of policies at the end, which we ultimately got to, rather than selecting policies early on, even though we had a sense that there was issues with density, there was issues with operating hours, promotions, all of the 4 Ps, place, product, price, and promotion, were really out of balance in Miami Gardens. And Miami Gardens is about 105,000 people, 71% are African-American, 26% are Latinx. It's a very strong community, and 30 miles northeast of Miami Beach. So we started collecting data, and this took a couple of years. We started with mapping the calls for service around the alcohol establishments, of which there's about 110 off-premise establishments that take the shape of grocery stores, pharmacies, convenience stores, retail stores connected to gas stations, few mom and pops still left in the neighborhoods. And looking at the calls for service, and what that told us were that where we had strong clusters and large numbers of outlets or significant numbers of outlets, we had higher rates of nuisance calls and other related calls. There had been some shootings around outlets. So there was already a concern around this. So mapping the calls, looking at sales to minors, doing some youth photo voice activities, environmental scans of the interiors and exteriors of a large number of alcohol establishments in town, having one-on-one conversations with residents who lived around the areas where we had higher calls for service and clusters of outlets. Interestingly, over 55% of the calls for service across a subset of about 14 to 15 alcohol-related calls that would show up in their computer-aided dispatch system were occurring within 500 feet of alcohol establishments. This data alone suggested to the community that there was an issue going on. Environmental scans, we're looking at the interiors, looking at the high-risk products that were being sold. Interestingly, different neighborhoods in the same community saw different products in the same stores. So a pharmacy chain half a mile from another pharmacy chain were selling much riskier beverages and had higher calls for service. Really interesting implications on equity as it related to this. So between talking to neighbors, talking to compliance agencies, code enforcement, planning department, law enforcement, having conversations with the ABC, a picture began to emerge about the kinds of issues that were being dealt with by neighborhoods. And from that then came a preliminary list of policies that the coalition was interested in focusing on related to density, really one touching on each of the four keys. They were concerned about the price of high-risk alcohol products like Alcopops and some of the emerging products that were mentioned. They were concerned about the promotion, the way which was being promoted in stores and outside of stores. They were concerned about the density of outlets. They were concerned about the sales hours. One of the things they found out was that the compliance rate for sales to minors was low. Over 40% of the stores were selling to minors. They also found out in their compliance checks that when the closing hours were midnight, every one of the stores, with the exception of one that they went into, were selling alcohol after the legal closing hours. And these were in the all off-premise establishments, mostly the gas stations that were selling. And the gas stations in Miami Gardens became the new convenience stores and became the center of gravity for a lot of the activity that was happening there. So the policies that were developed then were taken. We realized that there was a range of policies. Each one was focusing on one of the four Ps, in some cases two policies on the four Ps. We thought some of them may be preempted. And so we had an attorney who specializes in alcohol policy work do a legal analysis for us and really shape a menu of policies that the coalition could begin to then drive. And as we went through the media advocacy process, as we went through the community organizing process, we organized around those policies that were found to be not preempted, as well as some strengthening of enforcement protocols that were already on the books, but were not being enforced. There was language on the books to regulate the amount of advertising. There was clearly a policy related to closing time, but it was vague in terms of who counted in terms of having to close at midnight. So there were some other areas. And what came from this work was a series of policies that were introduced to the city council in 2021. A lot of this work was going on during COVID. So it made it difficult to do the kind of one-on-one relationship building with community members that we would have done. But there was enough energy with the community that we saw some strong support. The policies that ultimately got passed very quickly were a nuisance policy that put nuisance requirements, restrictions on the off-premise establishments, what are sometimes called deemed approved ordinances. There was a new policy to lock coolers at a certain time of night, where the coolers where the alcohol, particularly the high-risk alcohol products, were sold. There was a new policy to move the point of sale ice bins that had cold singles of malt liquors alcohol pops and other high-risk beverages away from the cash register where it was being sold. And there were strengthened enforcement protocols around closing the stores at midnight. And one which was not, that it was buried deep in the code, which was a sales of alcohol, a non-alcohol percentage requirement, where off-premise establishments could not sell more than 33% of their gross receipts could be in alcohol sales, which was a huge restriction that was not being enforced. So that's now on the books, and the new protocol for enforcing that's in place. So we did not get one thing we wanted. We wanted spacing requirements to address density over the long haul. That's something I think they're going to go back and seek support for as they move forward. The enforcement of these policies is taking time. I'll be completely honest with you. Getting the public will to pass them, which was, I wouldn't say easy, but moved relatively quickly. We had a unanimous vote of the city council to adopt all of those, including the enforcement protocols. Even though we had worked very closely with the organizations that were going to be enforcing these policies, it's a tough time, and there's not as many code and planning people. Law enforcement got their hands full. So we're working carefully on how to build the enforcement pieces associated with this. So I don't know how I'm doing on time.
We are out of time.
Okay, thank you. Well, then that is it. I will add, if anybody would like the data book that we created or the issue brief related to the work there, please let whoever's organizing this know, and we'll be happy to provide them.
And some of that is linked in the guide itself as well.
Great, thank you.
Thank you for that. Appreciate it. We're now going to turn to a state level example from Oregon, describing how a regulatory agency, the Oregon Liquor and Cannabis Commission, instituted a minimum pricing policy on distilled spirits. So we are now going to hear from Jess Nyworth from the Oregon Liquor and Cannabis Commission to hear more about that. Jess.
Thanks. Yeah, so I wanted to talk a bit about our proposal. So the Oregon Liquor and Cannabis Commission proposed a pricing formula to institute a minimum unit pricing for most popular bottle size with the lowest price point. And so a floor price, or the minimum unit pricing, is a minimum amount under which a manufacturer cannot sell a distilled spirit bottle. So it was a way to get at some of this pricing through rulemaking rather than through the legislature. And our research would show that meta-analyses and reviews of estimates from a large body of international empirical research show that a 1% increase in the price of alcohol will on average reduce demand for alcohol by around 0.5%. So this increases by orders of magnitude. And consistent evidence has shown that consumption is responsive to price, and increases in alcohol prices are associated with decreases in both excessive alcohol consumption and related harms among adults, which you all know. And we also see that an increased price significantly is associated with reduced underage consumption and harms. And so knowing these things, we wanted to pursue this pricing formula change. We are a control state, so that is something that the Oregon Liquor and Cannabis Commission has control over, is the pricing structure for liquor sales in a state. So we worked in collaboration with alcohol industry, with retailers, public health, our commissioners, and legislators to craft a viable policy option, and actually multiple options. Essentially what we did is we raised the price of 112 of essentially the bottom shelf liquors in a way that served a majority of our stakeholders. Retailers were earning more at point of sale. Our local distillers could compete with national brands. And most importantly, we're anticipating a change, and actually we have some data to share today of change we've seen in consumption patterns of our heaviest and other problem drinkers, and reducing associated healthcare costs. In our first year, we have seen that the sales have gone up actually 2%, but consumption of the bottom shelf liquor has gone down 13%. So that's pretty exciting preliminary data of the impact of the minimum unit pricing. So this change was initiated by the regulatory agency, the state regulatory agency, and it took multiple rounds of negotiation to determine what is the right dollar amount that would satisfy all of these stakeholders. We had been investigating and kind of vetting this strategy and idea for years, but could not successfully implement it until the environment was right. We needed external pressure from advocacy groups. We needed the trust to maintain trust of local businesses and a business strategy that state licensed retail agents would support. When a budget item that would negatively impact the retail agents came through the governor's budget, we saw our moment and began presenting our options to stakeholders. Our key kind of takeaway and lessons learned were threefold. One, collaboration. Two, being open to a variety of options and not having, this is our only strategy, this is the only way we're gonna go about it, and having those details set from the get-go. And then the third is advocacy. So thinking about collaboration, we worked with various stakeholders, and that was vital to ensure that the final regulatory action aligned with their interests. Stakeholders included representatives from the alcohol industry, our state agency commissioners, legislators, state public health agency, and treatment and recovery advocates. And when we look at being open to a variety of options, our agency researched a lot of different minimum unit pricing options with the potential to produce our desired outcomes. We approached our industry partners with these options. And there was a key step that was instrumental in maintaining momentum and interest in this idea. We sought to appeal to the strong local small business first value in Oregon by approaching Oregon distillers with a policy proposal. Our team determined that the price points of the most popular size liquor were significantly lower than other control state price points and accounted for a significant amount of bottle sales. But our local distillers were unable to compete with those price points here in Oregon with national distributors. And so we negotiated the minimum unit pricing with industry groups with the goal of starting with a small jump and then increasing that price over time. We then approached our public health and other advocates for support. Theory and evidence to date suggests that price strategies are particularly well targeted towards heavy drinkers and should be effective to reduce the amount of distilled spirit consumption by heavy drinkers, accompanied by a decrease in social harms and adverse health impacts. And our public health partners knew this, our advocates knew this. And after presenting these options to our health partners, we received multiple letters of support that bolstered our ability to convince decision makers that a minimum unit price would work well in Oregon. In retrospect, prevention and treatment agency support would likely have been useful earlier on to spur this project on faster, but this type of partnership was relatively new to our agency. And then third, key takeaway here is advocacy. Community advocacy and recovery groups were eager for action to address the high alcohol and other drug use rates in Oregon. These advocates provided external pressure on the agency to consider public health outcomes in decision-making. Coupled with recent budget decisions that impacted alcohol licensees, the external pressures really helped create an environment that supported the Oregon Liquor and Cannabis Commission effort to pass this regulatory action. And then lastly, just a note, each regulatory landscape is different. The specific actions that Oregon used to implement a minimum unit pricing scheme may not be directly applicable to your state, but the tactic to appeal to the business needs of the alcohol industry, as well as the division amongst them through the regulatory body, can be replicated to ensure that we're meeting these public health goals. Thank you.
Thanks so much, Jess. That was great. It's very exciting to see what Oregon is doing. So thank you for your time. Our last example, and we're going to try to get through it before we wrap up here, is about how community collaboration and advocacy can lead to legislation change in a very defined geographic area through a very data-driven approach focused on public safety. So we are going to now hear from Senator Corey McCray from District 45 in Maryland to describe what happened in Baltimore. Senator McCray.
Ms. Sparks, thank you for the opportunity, and just want to say welcome and congratulations to everyone that was successful. What I like to talk about is Senate Bill 571, and what Senate Bill 571 did was it limited the hours of 23 liquor outlets that had problematic in reference to just crime happening, especially major crime, big crime, homicides, attempted murder, and things of that nature within a 1 mile footprint. So if you can believe it again, I'll say it again for those that may not believe it, but 23 outlets inside of a 1 mile. But when we talked about crime, we looked at one of the outlets had 29 murders within 500 feet of that specific outlet within a 3-year period. We had one on Carolina and Preston that had 19 murders within a 3-year period. So every one of them, all of these 23 outlets had at least one homicide and multiple attempted murders in front of their specific outlet within 500 feet. And what we did was, it was actually the community. The community came together in reference to saying that they wanted to deal with this issue. And the first thing that we did was we took it to the major of our Eastern Police Department. We call it the Eastern District, but the Baltimore Police Department. And when we took it to the major, he challenged the question, why are liquor stores open from 6 a.m. to 2 a.m. anyway? And he had talked about in one other part of the city where they had one liquor outlet, not 23, but it possibly wasn't constitutional because it felt like it was targeting one establishment. But if we can draw out a geographic footprint where we are having high challenge crime, this will pass the constitutional muster. With that, we partnered from a community standpoint. We partnered with our police department, and we also partnered with our liquor board to say that we didn't want the liquor stores to open up from 6 a.m. to 2 a.m. We wanted the liquor stores to open up from 9 a.m. to 10 p.m. We also asked the question in reference to our young babies that walk to school. So if you were walking to your middle school and it's 3 blocks, you actually passed 3 liquor stores before the school bell even rang, which is why we also looked at the 9 a.m. Time frame. And from that piece of it, in 2020, we put forward this piece of legislation, Senate Bill 571, which gets past the Senate, it gets past the House. And for those that are not familiar with the Maryland General Assembly, we have 47 members in the Maryland State Senate. We have 141 members in the Maryland House of Delegates. It clears both chambers into its passage. From there, we then work with the liquor board to establish like what was the footprint and making sure the notification went out to the businesses that were impacted within the footprint, the 23 businesses. And from there, every month, the police department sends out information that also makes sure that we understand what is the correlation of the crimes that are happening, especially during the times that they are no longer in operation. After 1 year, we had saw that there was a 50% drop in reference to the homicides that were happening, because what we know now is that 9, 10 o'clock, that it gets dark. And what happens is people are drinking, it's dark outside, the wrong thing can happen. And that doesn't need to happen at 10 o'clock, 11 o'clock, midnight, 1 a.m., 2 a.m. in the morning. So we saw drastic reductions during those time periods from that standpoint. From there, Ms. Sparks, I'll, for the sake of time, stop right there. I think that it was we're 2 years into implementation. We do see a great amount of success from that standpoint, and we see a reduction within that footprint. So just thank you for this opportunity, more or less. But if there's ever any questions, I'll also put my email address in the chat.
Thanks so much, Senator McCray. And if you can go to the next slide, Van, just so you can quickly see the map of the affected establishments. And this map, along with some more data, is included in the guide. So you can see the police data that helps support this policy decision. So thanks again, Senator McCray. And now I believe I'm handing it over to Rob to wrap up for us.
Thank you very much, Alicia. And Senator McCray, thank you so much for your efforts in Baltimore. As with all of our case examples today, each of you are champions and heroes into your communities. And certainly from my chair, much appreciated all the hard work. You've received an awful lot of information today. I would just remind you that you can send all your questions. It'll be in the chat to the EBRC team. They will be happy to get back with you with some specific questions should you need so. You can also download the guide. And then finally, I'd just like to say, if we could all just take a minute to send positive thoughts to Chuck. as he's navigating the storm. Anybody who's been through one of those knows you can use all the help you can get when it comes time. So with that, let me close this out, and I'll turn it back over to Van.
Thanks, Robert. Just quick housekeeping items that you've seen there in the chat about 20 times or so. So please follow the link to our survey today. You can also just take your phone out right now, point your camera at your screen, and the QR code will take you right to our survey. So within a week, you'll receive a follow-up email with a link to the recording of today's presentation. It'll be on our pttcnetwork.org website. And you'll also have instructions there for downloading your certificate of completion. Thanks for joining us. Have a good afternoon.